Okay, this one's kind of a two or maybe even three-parter. I'm sorry. Okay, so first of all, you said that one of the problems with socialized healthcare is that a lot of the treatment's based on like how quick you can run and who you know. And how would you argue against that being also a huge determining factor in capitalism as well as the speed and who you know being a major determiner of success in the capital system?
Okay, let me answer that and then we can go on.
Okay.
Yeah, I mean, in capitalism, it's how much money you have, which I think is a much better standard. Because how much money you have is a reflection of how productive you've been. And therefore, you're rewarded for that productivity. I mean, people say money doesn't buy you happiness. Well, but it does in many respects. It doesn't buy you happiness, but it allows you the options, many more options, to gain that happiness. Among others, healthcare. It allows me to buy a bigger car, it allows me to have a nicer home, and it allows me to get better healthcare than if I didn't have money. But that to me is a virtuous thing. It's not a bad thing. Money is something that you earn. Money is something that you earn by creating, by producing. And if you create and produce it and you have the money, then yeah, you should benefit from that fact. And under a free market, people with money would get better healthcare than people without money. That's just a fact. But I would argue that even the people who don't have money or have very little money, would get better healthcare under capitalism than the middle class would get under socialism. That is, that healthcare, in general, the quality would rise dramatically. And the costs under capitalism, every product under capitalism, the cost does what? Almost every product over time, cost goes down. The iPhone, next version is going to be cheaper than the iPhone I have now. And it's going to be doing more things. Your computer, you buy for $1,000 or $2,000, to get that kind of computing power 10 years ago, you would have had to pay tens of thousands or maybe hundreds of thousands of dollars in order to get it. Under capitalism, generally, things go down in price over time. Quality goes up, price goes down. And the same would happen under healthcare. Under private, why is healthcare so expensive today? Who buys the most healthcare in the United States today? Almost 50% of all healthcare is bought by government. Now, when government buys healthcare, what happens? When government buys hammers, what happens to the price of hammers? It goes way up. You remember the toilet seats or the hammers that cost $2,000? I mean, it's not their money. It's not real supply and demand and the laws of economics. They have a budget, they spend it. So Medicare and Medicaid drives up the cost of healthcare, increases the use of healthcare, and drives up the cost of healthcare. So under capitalism, prices go down, and therefore, and quality goes up, and therefore poor people can afford it. The same with insurance. Why are people uninsured in America today? Well, because the insurance market is so heavily regulated. The insurance, the number of products that an insurance company can offer is so minuscule and so restricted. And they have to cover so many things. They have to cover mental health and chiropractic and gazillion different things that most of us don't want. But we have to pay for when we buy health insurance. Imagine a true free market in health insurance without a bureaucrat telling them what to include and what not to include in a policy. You'd have 100 different products. Why do we have so many different cars? Well, because the regulators have relatively left cars alone. Why do we have so many cell phones? Because the regulators have left it alone. So we have a huge variety of cell phones. Well, if the regulators left insurance alone, you'd have a huge variety of insurance, types of insurance. Huge, large deductibles, small deductibles, covering pre-existing conditions, not covering pre-existing conditions, covering chiropractors, not covering chiropractors, all of those options, and you could buy them, and you could buy cheap health insurance. And I would bet you that many, many, many more people would be insured under a private system than are insured today. Because they'd have options, and they would be cheap. And insurance costs would drop, because healthcare costs generally would drop if the government stepped out of the healthcare business. Okay? So, I believe that the quality goes up, price goes down, the poor can afford more health coverage than they can afford today than the government. Oh, there's this great statistic that came out a few weeks ago. They showed that privately insured patients who have cancer or heart disease live longer than uninsured, or more importantly, than Medicare and Medicaid patients with exactly the same diseases. And why? Because you get better service under private healthcare. You get treated better. So private healthcare is far superior. Now, true, there will be a difference between rich and poor, just like there is in any other good that we practice. But I don't see that as a bad thing.